The Wall Street Journal. Why vaccine skepticism is growing on the right. This was in the paper today. I want to talk about this. Can you feel the tectonic plates of this pandemic shifting? We had the president come out recently and say that in May, the emergency orders will be done. You are starting to see this pandemic seems to be sort of drifting away, not with a roar, but a whimper. But in the Wall Street Journal this morning, this is what we see. I am not going to inject many of my thoughts at all, just the facts from the article. The Wall Street Journal, based out of New York City, and if you go to media bias ratings, it's generally rated in the center and reliable, the Wall Street Journal. So let's talk about the article written by Alicia Finley, Why Vaccine Skepticism is Growing on the Right. Subtitle, Public health officials imposed mandates and kept news of potential side effects under wraps. I'm just going to read. Public health authorities have since fueled distrust by overselling the benefits of vaccines, pushing them on children who are at low risk for serious illness, mandating shots while playing down potential side effects, and smearing those who raise concerns as spreading misinformation. Fourth paragraph of the article. Anthony Fauci was among those who misled the public in May 2021. Quote, when you get vaccinated, you not only protect your own health and that of the family, but also you contribute to the community immunity. Reinfections are common. In an article last month in the journal, Dr. Fauci and two co-authors described in dense scientific detail why it's so hard to develop vaccines that provide lifetime protection from infection by respiratory viruses. Quote, the article asked, quote, if natural mucosal respiratory virus infections do not elicit complete and long-term protective immunity against reinfection, how can we expect vaccines, especially systemically administered, non-replicating vaccines, to do so? It appears here that the article, Tony Fauci, is saying, well, if infections can't do it, then how could vaccines? It seems like he's elevating natural immunity from infections over vaccines and saying if the natural immunity can't do it, then certainly vaccines couldn't. That's a switch. Next paragraph. But public health officials nonetheless suggested that COVID vaccines would help achieve herd immunity and reduce transmission. That was the premise for the Biden administration's vaccine mandates, which look even worse in hindsight. The Food and Drug Administration officials were concerned that the FDA's review of Pfizer's vaccine during the summer of 2021 was being rushed. Marianne Gruber, director of the FDA's Vaccine Research Office, warned the acting commissioner, Janet Woodcock, in July 2021 email that the hyper-accelerated review would undermine confidence in the vaccine. The FDA earlier that month had quietly published a statement on its website that it had detected 4 potential adverse events related to Pfizer's vaccine in seniors. 1, pulmonary embolism, a blood clot in the lungs. 2, acute myocardial infarction, a heart attack. 3, immune thrombocytopenia. That's a low platelet count due to your immune system. 4, disseminated intravascular coagulation. In other words, you're getting clotting all over the body, frequently lethal. So let's go over those again. A clot in the lung, heart attack, low platelets, or clotting everywhere. Increased risks from the FDA's preliminary review for these potential adverse events range from 42% to 91% increased risk. According to Dr. Gruber's email, her colleague, Peter Marks, director of the FDA's Center for Biologics Evaluation and Research, had expressed concern that cases were rising in the U.S. It was his opinion that states cannot require mandatory vaccine without full approval. The FDA reviewed and approved Pfizer's application in less than a third of the time it takes for a typical drug approval. The Biden administration imposed vaccine mandates without exceptions for prior infections. As vaccine protection against infection waned, public health officials pushed boosters despite little evidence that their benefits outweighed the potential safety concerns for healthy young people such as myocarditis. Yet, vaccinated toddlers in Pfizer's trial were more likely to get severely ill with COVID than those who received a placebo. That's really important. So in Pfizer's trial, if you vaccinated a kid with the real vaccine or gave him a placebo, the vaccinated kids were more likely to get severely ill. Most kids who developed multiple infections during the trial were vaccinated. Pfizer says all information is reviewed meticulously by experienced medical and clinical experts. And, quote, non-experts reviewing such scientific data is likely to lead to information being misinterpreted or taken out of context. The author of this Wall Street Journal article says, got it. What she's saying is Pfizer's dissing anybody other than their experienced medical and clinical experts who are saying what they want. The non-experts, not quite so capable as what Pfizer's saying. Only in December 2022 did the FDA publish a detailed analysis on the 4 safety signals. Remember? Clot in the lung, heart attack, low platelets, clotting everywhere. Those are the 4 signals. In December of 22, they came out and said that the study did show a safety signal for clots in the lung, pulmonary embolism. But the study's most noteworthy revelation, quote from this article, was that some signals were first detected in February of 2021. Quote, if the FDA could review Pfizer's vaccine application in only a few months, it shouldn't have taken nearly 2 years to investigate and publish a study on potential side effects. Alicia Finley closes with this comment. Authorities no doubt worry that alerting the public to potential safety risks could discourage vaccination, but their lack of transparency and dismissal of critics fuels the distrust in vaccines. Let me close with this. A doctor wrote to me today and said, the public does not generally realize that the CDC is not strictly a government entity. It receives pharmaceutical money and functions as a public-private partnership. You see, the CDC has a foundation, and pharmaceutical companies can donate heavily to the foundation. And then the CDC Foundation doles the money over to the CDC. This is a common ploy. And does the FDA receive money from individual pharmaceutical companies? Yes, billions of dollars. So when the Wall Street Journal comes out and really takes a stand and said, why vaccine skepticism is growing, I think it's clear. We need to be paying attention. And remember, Dr. Paul Offit has come out and said, we shouldn't be boosting the kids, vaccinating the kids. And he's been a powerful advocate for vaccines. We have seen Dr. Levy from MIT come out and say the program should be stopped. We have seen Dr. Asim Malhotra from United Kingdom say we got to stop it. We have seen numerous people step up and say it needs to be stopped. And the Wall Street Journal is helping move the tectonic plates of the pandemic discussion. Have a good night.